I've been intrigued for the last 25 years about what it is that allows certain healthcare organizations, certain hospitals, for example, to achieve very high levels of patient satisfaction while maintaining fiscal accountability, and yet doing it in a way that would suggest that they are very adaptive, very resourceful organizations, very resilient to change. And as a result of my doctoral research, I'm very excited about the fact that I've been able to, I think, isolate, using complexity science as the framing theoretical background to it, 7 factors that facilitate that kind of emergent change that is so evident in adaptive systems. Emergent change that occurs when the people closest to the problem come together without having a prescribed sense of exactly what they're going to do and how they're going to do it. Based on an extensive literature review, based on 15 interviews with hospital CEOs and ministry people, and through my own practice experience, I was able to distill those 7 factors that allow us to navigate what Peter Vail calls the permanent white water that our organizations try to navigate through. So what are those 7 factors? First of all, a purposeful orientation. Is everyone in the organization crystal clear what it is they do and why they do it? What's the why of their work? And that everybody shares a common sense of purpose. The second would be executive engagement. A highly engaged, highly visible, yet non-manipulative, non-controlling executive team that people know, people recognize, and that people feel supported by. Collaborative decision-making structures. So collaborative care models and structures that allow people to get together across disciplines, across professional boundaries, but also allow them to work to the full scope of practice. And with that, collaborative quality. That quality measures are not imposed from the top down, but rather emerge naturally out of the work that's being done. A culture of experimentation. This is where ideas like positive deviance have had a tremendous impact on certain hospitals. How do we let people at the bedside that understand their context and their situation best? Do we create the culture that allows them to create the quality benchmarks that serve them best? And within that culture of experimentation, do we have a culture that would be called safe fail, a term that Brenda Zimmerman uses? In other words, a culture that says it's okay to make mistakes, it's okay to try new things as long as we're learning and moving forward all the time. Intentional learning structures, ensuring that people have the opportunity, the systems and the processes in place that allow them to learn. There's a critical element that as an organization, we're not just talking about being a learning organization, but we're actually embodying that and living that out. What I found in a series of focus groups after the fact was that it wasn't any one of these factors that was vital. It was the combinatory nature of them, the way that they all played out. The primary thrust of my doctoral dissertation and the subject of the article in this month's journal is the development of a validated online assessment instrument that now allows us to measure the presence or absence of these 7 factors in a given organization, and thereby develop some strategy as to how we might strengthen the organization in terms of its resilience, its agility, and its ability to embrace transformative change, that truly emergent change that produces results that no one perhaps could have predicted. And that's something I'm very, very excited about. That's better.